Welcome to the Amazing Charts tutorial for ICD-10, Preparing Your Practice. The purpose of this video is to give a good overview of the changes to the ICD code set and what you can do to prepare your practice. ICD-10 is the 10th revision of the International Statistical Classification of Diseases and Related Health Problems, which is a medical classification list by the World Health Organization. It contains codes for diseases, signs and symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or diseases. ICD-10, however, is not a new coding system. These codes have actually been in use internationally since 1999. The US has developed a clinical modification version for the medical diagnosis based on the World Health Organization's ICD-10. This code set, officially called ICD-10 CM, is now commonly referred to as simply ICD-10. This code set is scheduled to replace ICD-9 on October 1st, 2015. ICD-10 code sets are used in almost every clinical and administrative process in healthcare. There are two different code sets. ICD-10 CM is used for medical diagnosis coding to report various conditions, diseases, or symptoms, as well as utilized for reporting, payment, and research. ICD-10 PCS is a code set designed for inpatient procedure reporting and is used mainly by hospitals. This changeover to ICD-10 will affect diagnosis coding and inpatient procedure coding for everyone covered by HIPAA, not just those who submit claims to Medicare and Medicaid. CPT coding for outpatient procedure will not be affected, however. This changeover is set to happen on October 1st, 2015. CMS and other payers will only recognize and process ICD-10 codes for dates of service occurring after the compliance date. ICD-9 codes will continue to be accepted for dates of service prior to the compliance date. A claim can only have one code set. You cannot mix ICD-9 and ICD-10 codes on the same claim. There are some fundamental differences between ICD-9 and ICD-10. Here you can see the difference between the two code sets. In comparison, ICD-10 has the potential to contain more characters. It includes laterality when needed and uses a lowercase x as a placeholder for unused digits. The code structure for ICD-10 CM is fairly easy to understand. The first three characters denote category. The next three are for etiology, anatomic site, or severity, and the last character is an extension. When we break it down even further, the first character is always a letter, from A through Z, excluding U. The second character is always numeric. The third through seventh characters will either be a letter or a number. The fourth through sixth characters are used for laterality. They may also contain a filler digit. This is used as a placeholder to allow for future expansion and to fill in any empty characters. The seventh character is used mainly for injuries and denotes the encounter using an A, D, or S. There are also additional characters used for fractures. The alpha characters at the beginning of the code allow for easy classification of the code. There's a total of 21 different classifications of codes, and they are grouped together in a logical way. For example, all mental and behavioral disorders will always start with an F. Diseases of the circulatory system, such as hypertension, will start with an I. Knowing the classifications will help you in your search for the codes. One change that most providers should be aware of is V codes for ICD-9 are now Z codes for ICD-10. So some of the more common codes would be Z00.00, General Adult Medical Exam without abnormal findings, Z00.01, General Adult Medical Exam with abnormal findings, Z00.110, Health Exam for newborns less than 8 days old, Z00.111, Health Exam for newborns 8 to 28 days old, Z00.121, Routine Child Exam with abnormal findings, Z00.129, Routine Child Health Exam without abnormal findings, Z codes are not used for injury or trauma, but they can use for follow-up and aftercare visits. The 7th character in the ICD-10 code is unique for ICD-10. This will mainly denote if a visit was an initial encounter or a subsequent encounter. There are additional characters for stages of healing and fractures, but let's look at the common ones. A is for initial encounter, meaning the physician is actively treating the patient for the injury. D is for subsequent encounter, meaning the patient has received active treatment for the injury and the physician is now providing routine care for the injury during the healing or recovery phase. S is for sequela, meaning complications or conditions that arise as a direct result of the injury, such as scar formation after a burn. So if you look at how an ICD-10 code is constructed, the first 3 characters are for the category. So we'll use S52, which is a fracture of the forearm. Characters 4 through 6 build on that code, involving etiology, anatomic site, severity, or any other clinical details. So S52 becomes S52.5, fracture of the lower end radius. That becomes S52.52, which is torus fracture of the lower end of radius. Finally, we add in laterality, and the code becomes S52.521, which is torus fracture of the lower end of right radius. Now, because this is an injury, we can add the 7th extension character. This gives us S52.521A, torus fracture of the lower end of right radius, initial encounter for closed fracture. With ICD-10, coding becomes more descriptive. If your exam is due to external causes, then you may want to have the following documented: what happened, when it happened, where it happened, and how it happened. For example, a patient that has a closed fracture of the right ankle due to a fall from a jungle gym at the park. With ICD-9, you add 2 codes that you would use: 824.58 for the fracture of the ankle, closed, and E884.0 for accidental fall from playground equipment. With ICD-10, the coding becomes more complex. You can have up to 4 codes that you would use: S85.51XA for closed fracture of the right ankle, Y93.39 for involving climbing, W09.2XXA for fall from jungle gym, and Y92.830 for in the park. As we can see, the coding tells a story of what happened in a more complete way. Not all of ICD-10 is complex, however. Coding for immunizations got much easier. Immunizations now all fall under one code, Z23. You do not need to match the vaccine diagnosis codes with the correct CPT vaccine anymore. With this expansion of codes, the CMS 1500 form will expand as well. You'll be able to have a maximum of 12 diagnoses on the form, labeled A through L, in box 21. This will give you the additional room for the expanded codes needed. So what can you do to prepare for this change? First is to prepare a timeline based on your practice. Know when you need to get things done by, and spread it out so it's not all happening at once. You can also identify your top used ICD-9 codes and see how they convert over to ICD-10. This will make the transition easier if you are familiar with your most used codes. You should contact your payers and find out what they have in place to help remain compliant. And contact your clearinghouses and billing services and inquire about their implementation plans. I would also recommend you look at your workflow and determine if there are any training needs that need to be addressed to improve office flow. You also want to review the documentation requirements and identify gaps in documentation standards. It's also a good idea to conduct internal and external testing of ICD-10 before the changeover date. Lastly, you want to prepare your practice for the financial impact of potential delayed claims as the new systems get into place. In the end, Education and preparation are the key to using new ICD-10 codes. Along with education from outside vendors, Amazing Charts has a wealth of knowledge on our website. Just go to www.amazingcharts.com, click on the Product tab at the top, and select Product Tour and then ICD-10. You'll find articles, links to outside resources, and other videos here. If you have any questions, you can contact us at support@amazingcharts.com.